So the bottom line is, if you're struggling to hear in both ears, putting hearing devices in both sides is what's going to give you the best outcome. Not only will you get better clarity and balanced sound, you're going to get less listening fatigue. And what I mean by that is if you're working hard to hear, whether it be with no hearing devices or just one, what happens is you're putting a strain on your brain. Our brains are designed to help keep us safe. We think, our brains tell us when things are going to be concerning to us, look out for this, don't step on that, etc. But when you're having to put your brain to work to help you hear because your ears can't do it alone, what happens is this cognitive or brain fatigue. Doing that day in and day out can exhaust you. Many of our patients will report when they go out for an evening, they get home and they're wiped out, and they just assume it's because of their age, when in actuality, they're working harder than anyone in that room to hear. If you're doing that day in and day out and putting that strain on the brain, what happens is you're putting the brain at risk for atrophy. It can shrink and start to experience cognitive decline like dementia and Alzheimer's. And that's a slippery slope. Once you go down it, there's no reversing that. So we definitely want to make sure that we're maximizing your hearing, we're lowering that cognitive fatigue. So the bottom line is, if you're struggling to hear in both ears, putting hearing devices in both sides is what's going to give you the best outcome. There's no reason to struggle. We were designed to hear in stereo, and that's exactly how we should hear.